Hi, welcome to training module number 10 for AdvancedMD and Medicom Management Services, which has actually undergone a name change at this point. Medicom Management Services is now called Advanced Health Partners Incorporated, so we'll begin using the new name moving forward. This training module actually is the start of really using AdvancedMD on a daily basis. This really isn't the electronic health record use yet, but it's something that you can do every day as a provider, as a physician, physician assistant, nurse practitioner, which actually is meaningful and goes beyond just training and looking around. So in this stage, we're going to look at printing discharge instructions out of AdvancedMD on a patient-by-patient basis. And the reason we're starting here is because this really, at least at first, is an optional thing that you can do when you feel you have the time. My personal feeling, and I believe the feeling of each of the companies, will be that discharge instructions are required on every patient. I think that's what makes the most sense medical legally and as a good gesture toward the patient, and they get to walk away with something, and that something will be branded, with the company's logo on it. But again, kind of start here just because, if you can't get to it for some reason, it's not the end of the world. It's really an optional piece. It helps you ease yourself into the system. So let's just jump right into it. I'm in a key and I pulled up a patient Mickey Mouse here, and I want to provide Mickey Mouse with some sort of discharge instruction. So if I look over on the left at the appointments, we're going to pretend that today is 8/31/2012 because you actually have to attach the discharge instruction to a particular visit. You don't want everything over here on the left really should be linked. I've used that word a few times, linked. And if you could see, these are all tests, but you can see how these are all linked to this appointment here. So we want to link Mickey's discharge instructions to the appointment on 8/31. So I'm going to take my cursor and place it on that appointment somewhere, right over where it says established patient, and I'm using a right click here. So you right click and you get a sub menu, and then you're going to add a new linked, and then it pops up and you have more options, and it is the first one. It's patient note. So it doesn't actually say discharge instruction here. It says patient note. The reason for that is these discharge instructions that are loaded are actually not included with AdvancedMD. This is sort of an add-on that Advanced Health Partners came up with. So we sort of inserted all this data in here, and it does. There are about 1,000 different discharge instructions you can use. So there is no real intuitive way to do it within AdvancedMD. Nothing built in. This will appear like it's built in, but it really wasn't. So you're going to choose patient note. And if you've set all your preferences properly in the last stage, you should be presented with this screen. If you did not set your preferences properly, this will not be the screen you see. So if you don't see this screen right now where you have a discharge instruction option, a follow-up option, and a school work release option, then you didn't set something up right in the last stage. So I'll advise you to go back and make sure that that's done. Okay, so here's where you're going to set up your discharge instructions. This box right here that we're looking at, you can type any free text you want. So say, gargle, gargle with salt water. Anything you want here. This is for you to add any personalized instructions for this visit. Okay? It's not necessary to put anything in there if you don't feel it's necessary. After you type your special instruction, you're going to come down below the box and you're going to, again, right click, and you're going to be presented with a lot of different options. Okay? Everything here is based alphabetically. These are your discharge instructions, all of them that start from A to B, or C to D, and so forth. Again, there are about 1,000 different discharge instructions in here. If you don't find what you want, for example, if you're looking for otitis media and it's not exactly what you're looking for in there, look for ear infection. So you'll get used to where all the different discharge instructions are. You'll probably have a repertoire of 10 or 20 that you use commonly, but of course there are many in here. So for example, like I said, if you're looking for otitis media, let's go down to O. I've got otitis media with effusion. Well, This particular patient didn't have any fusion. Let me go look and see if there's something under ear infection. Oh, here we go. This is a little bit better. Okay, maybe it's serous otitis media. Okay, so you choose this. And what it does is it drops just the title of the discharge instruction right here. Okay, this isn't what the patient sees. This is what we see. Okay, so we got gargle with salt water, which really doesn't make sense for serous otitis media, but that's fine. This is the discharge instruction I'm going to print for the patient. Okay, at this point, you really need to save and sign this document. Okay, I'm not going to sign the, actually I can sign the document. So I'll come right here and I'll sign off on the document. I'm going to type your password just like you sign off on everything else. You may have noticed that this popped up over here on the left, that we have discharge instructions that are linked to this visit, and it's white, so I know it's signed. And now I want to go ahead and print this for the patient. Your first inclination is going to be to use this print button right here, but that's not going to work. This isn't actually how you print it. If you use this print here, the patient actually gets what you see on the screen. They get this, and that's not what we want them to have. So you're going to go over here to what's called the word merge. And if you look here, it says print merge, and you're going to print the discharge instructions. So I just clicked print discharge instructions. This takes a few seconds to open up. You have to click open, unfortunately. And then it actually popped up on my other screen, but here's what showed up on my other screen. It's basically a Word document. So now it opened up in Microsoft Word. It has the patient demographic information over here, the date of the visit, the provider name, some branding. Here is your personalized discharge piece. And here is the, I'll call it a canned or, pre-configured serous otitis media discharge instructions. Okay. These discharge instructions were obtained from a company called Exit Care. They do get updated occasionally. But if you read through and you don't like something in here, you can actually alter this too. So this is all editable text. Okay. I find that for the most part, for most of our patients, this does suffice. You may want to add things in here, or you may just add it up in this discharge instruction area where you could have done it in the box. Okay, so here's your discharge instruction for serous otitis media. You need to print this. So depending on your version of Microsoft Word, you have to go to File and Print. Okay, or you may have a quick print right here. I'm not going to print it, but I would click this and it would print. You may have to choose your printer properly. So if the manager needs help with the printer, please call and let me know. And we'll get somebody technically to make sure it routes to the printer you want it to route to. Then I'm going to close this. It may ask me if I want to save it. Sometimes it does. I don't want to save it because even if I save it, it's not going to save within AdvancedMD. All right, AdvancedMD has it this way, and it creates it fresh really every time. Okay, so you don't need to save that. All right, then you're done. Your discharge instructions are completed. Okay, so that's going to end this module. I'm going to come back and recap this a little bit and then talk about the follow-up and the school release. Okay, thank you.